Feeling overwhelmed by electrolyte imbalances? Let's make sodium, potassium, calcium, and magnesium easy to remember in under 5 minutes. Welcome to the Nursing Notebook, where we break down complex nursing topics with simple visuals and clear explanations. Subscribe for weekly videos that make nursing school a little less stressful. Let's start with sodium. The normal range for sodium is 135 to 145 MEq per liter. What to remember about sodium is that it affects the nervous system. Hyponatremia, or low sodium, can lead to confusion, seizures, and weakness. Hypernatremia, or elevated sodium, causes thirst, dry mucous membranes, and agitation. A good memory tip for these side effects is, sodium swells the brain, an imbalance equals neurosymptoms. Next, let's move on to potassium. The normal range for potassium is 3.5 to 5.0 MEq per liter. Potassium plays a large role in heart conductivity. Hypokalemia, or low potassium, is shown in flat T waves, muscle weakness, and cramps. Hyperkalemia, or too much potassium, can be seen with tall peaked T waves, arrhythmias, and paralysis. To remember this about potassium, think, K is for the cardia. Calcium is the next electrolyte we will cover. The normal range for calcium is 8.5 to 10.5 milligrams per deciliter. Calcium aids in muscle function and building bones. Hypocalcemia, or low calcium, is shown with muscle spasms, Chvostek's sign, shown by a twitch in the cheek, and Trousseau's sign, shown by using a blood pressure cuff. If you want more information on how to check for Chvostek's sign or Trousseau's sign, comment below, and I can make a separate video on that. Hypercalcemia, or excess calcium, can lead to lethargy, constipation, and bone pain. The memory tip for calcium is, low calcium equals twitchy. High calcium equals sluggish. Finally, moving on to magnesium. The normal range for magnesium is 1.5 to 2.5 MEq per liter. Magnesium influences nerve and muscle relaxation. Hypomagnesemia, or low magnesium, results in tremors, seizures, and increased deep tendon reflexes, also known as DTRs. Hypermagnesemia, or too much magnesium, can be seen with decreased DTRs and respiratory depression. A memory tip for magnesium is, magnesium equals mellow. Let's recap. Sodium aids in brain function. Potassium has a big influence on the heart. Calcium targets muscles. And magnesium is related to calm, relaxed muscles. If you liked this video, be sure to subscribe and follow the Nursing Notebook for weekly visuals and nursing hacks you'll actually remember.